So a little bit about myself. I figure that's a good way to start. Well, I can't move it. It is what it is. A little bit about myself. I am an athletic trainer by trade. So when you're watching sports and you see someone get hurt and that person that runs out on the field, that's what I have done since 2009 up until 2021 when I got into this world of ergonomics specifically. And I work with a ergonomics company up here in Chicago, CIP Solutions, where we work with utility workers. So that's kind of my expertise, is looking at how we reduce these risks. Specifically today, we'll talk about with the elbow because it is one of the most common injuries that many of us will come across and deal with in any type of setting, really. Disclosure: I really have no financial or non-financial conflicts. I'm just presenting this solely with the intention of knowledge sharing for the advancement of health and wellness for those that work in safety. And I currently work for, as I said, CIP as an athletic trainer. So the objectives, they are here: recognize common injuries with the elbow, understand key ergonomic risk factors for the elbow, identify simple job specific movement strategies to prevent and manage elbow discomfort, apply one technique called the mobilization with movement technique. That I think would be easy for you guys to implement in a pre shift warm up, that you guys could kind of use to help reduce some of the elbow discomfort that people may be having, whether it's from work or outside of work, because a lot of times this happens there as well. And then promote a proactive safety culture by sharing these practical tools with your crew members. So why should you guys care about this, right? Especially in utility work, which is where I work, it includes a lot of repetitive and high load tasks that are major risks for issues. A lot of these workers have about 1 to 4% of them do have either medial or lateral elbow pain. So it's super common amongst our populations, especially whether it's physical, even office workers. So a lot of us deal with someone who has this type of issue. Story of Cindy Palmer's life. So here we go. Maybe I can give you some tips and tricks, right? That's the idea. And we look at these people who might have some type of forceful exertion greater than 5 times a minute. That does increase the risk of lateral epicondylitis by fivefold. So that's why with my population, whether it's manufacturing, utility, construction, if you're doing something where you're forcefully exerting yourself, your hands and your elbows more than 5 times a day or a minute, you are susceptible to this. Injuries equal lost time, reduced productivity, and increased costs, right? We're all trying to reduce that to reduce the bottom line, right? And then proactive strategies to prevent downtime and improve worker longevity, right? A lot of times, especially with me, my job is to maintain your health and wellness inside and outside of the workplace, right? I don't want you going home, or I don't want you retiring decrepit like an NFL lineman, right? I want you to be able to go home and enjoy your retirement, enjoy your kids, enjoy your family, enjoy your hobbies. So that's where I really focus on a lot of this. Some stuff on lateral epicondylitis. I'll kind of just breeze through this because I want to get to the good stuff. It's commonly linked to, so this is tennis elbow lateral epicondylitis. It's commonly linked to reduced wrist and finger extension strength or grasping strength, right? So gripping type stuff. It affects 1 to 3% of the general population. It's most prevalent in adults aged 30 to 60. So a lot of our workforce, right? And it's typically a gradual or insidious onset, where there's pain out on the outside of the elbow, and it may even radiate down into the fingers. There's often no cause to it. They don't remember any instance where I went and grabbed this box or pulled on this, and all of a sudden I have this discomfort. And you may not even have swelling or signs of inflammation or range of motion deficits. You are 7 to 10 times more. It's more common than medial epicondylitis in the general population, and it's often your dominant arm. Occupationally, we're looking at any of those tasks that have a lot of repetitive gripping, where you might have a wrist extension, right, or a radial deviation. A lot of times, if you look at how you extend your wrist, right, you'll see that when you extend your wrist, you kind of what we call radially deviate, which means your wrist kind of moves towards that thumb. Or if you're supinating, right, so when you roll your hand over like this, so any type of turning of a knob, doorknobs, those types of issues, that's where this kind of causes that issue, these types of tennis elbow issues. Also, awkward elbow and wrist postures are a huge risk factor for that. So I think of this when I think of this, I think of like maybe like moving things, or like maybe you're a mechanic and you're doing a lot of cranking, right? Using a wrench, you have to create a lot of force, right? That's a huge issue with that. And then a lot of risk factors: smoking, obesity, and diabetes, right? This is a huge thing in a lot of our workforces. So a lot of our patient population or employees are actually at risk of this. When you look at medial epicondylitis, so pain on the inside of that elbow, we have it's less common. We call that golfer's elbow because a lot of times that's where all the flexors of the elbow, so the muscles that flex your fingers and your wrist down, they all attach right here in your elbow. So it's less common, and it commonly affects the flexor carpi radialis and pronator teres muscle. Right, it's prevalent in up to about 4% of the working population. It's most common in ages 40 to 60, and it's more frequent in women than in men. So if you think of that, it's because a lot of women often have more of the desk jobs as well, which is you're working on poor ergonomic workstations where you might be typing a lot, working at your desk, and your ergonomics are not beneficial. So you get these types of exacerbations in your hands and causing golfer's elbow, even though you're not playing golf or haven't ever played golf. Right? Repetitive movements, again, are a risk factor along with smoking and obesity. Okay. Also, with this one other big thing that I thought on this, think of a manufacturing plant or assembly line where you may be working, moving boxes or moving an item. If you take a poor mechanic and you actually kind of are sliding stuff a lot, you create this valgus stress on the outside of the elbow where it moves in and causes this rotation of your elbow that causes that to actually, oh, I swung my chair around, causes that flexor in the wrist and the medial portion of your elbow to kind of rotate, which actually does cause some of that exacerbation of that medial epicondylitis right there. And also any arm swinging, if you're swinging stuff overhead, moving stuff, that also. So this is where a lot of pitchers and baseball type athletes cause that creation because they get a valgus force where that rotation of that elbow, and they're throwing and doing this type of motion as well. So you can think in your workplace how many people are doing these types of movement patterns that could cause that type of discomfort for them. Here's just a little chart showing kind of what each, A versus B. What is tennis elbow, golfer's elbow? What types of things might I be feeling with tennis elbow versus golfer's elbow, just for you to have and just kind of look at and just contrast, compare really quick. So, meat and potatoes. I kind of want to get to how do we reduce this this on the job, right? So we have to think of neutral wrist positions, right? So we want our wrist to be pretty straight, as a lot of us know with ergonomics. We want that neutral wrist position, supported wrists when you're at your workstations, things like that. But you could use vibration reducing gloves that are out there to help reduce the amount of micro repetitions that you're actually having as you might be working on a jackhammer or something like that. Rotating high risk tasks, so change those up so that one person is not doing the same type of thing on the same arm to the same side all the time. How do we reduce and mitigate some of those repetitions so that every employee is kind of sharing that load, which will then reduce the amount of elbow discomfort that people have. Stretching before tasks also can help, along with encouraging just breaks, right? Micro breaks, as we call them. Just take a minute. If you are in a position where you're doing a lot of, this motion here, take time to maybe do a reverse posture where you're kind of just reversing that motion, doing the opposite of those motions you guys have or that you are doing a lot of, right? So the anatomy really quick. The reason I want to talk about the anatomy is because what I'm going to do is kind of propose a new way. A lot of us have all these already. We know that, right? We've read this in all these, CEAS certifications. We've heard, how to reduce the tasks, use it, mechanical means, things like that. Well, what if there's another way? And that's why I want to talk about this. And I kind of propose it through what I call a construction model, right? So if you think about the elbow in general, you think of like building a house. This is how I think of it. When you look at the studs, you're thinking of the bones with that, right? The bones kind of help support all the other structures. Everything kind of attaches to the bones. They're the foundational piece. If I build a house and I put the studs up crooked, everything else that I put up in that house is going to be crooked as well. So that's why they're the most important thing and the first spot I go to when I look at how do I reduce these types of discomforts. The nails are typically like our ligaments that hold bone to bone, right? They don't flex, they just kind of hold it together. They're like pieces of tape. They're the nails. Then the wiring is kind of like our nerves. Our plumbing and lymphatics plumbing system is our circulatory system, so the veins and arteries in our body, and then the walls are the muscles. The muscles kind of hold everything together. They cover up all the other stuff, and yeah. So here's a little anatomy here. You can see the when we look at the elbow, you have the humerus, which is red here. You have the radius, which is blue, and you have the ulna that is green, right? And if you look at this, the top part of that elbow, the humerus, just sits on top of the radius and the ulna, kind of like a golf tee, right? It does protrude a little bit further in the back, but as you flex it there, a lot of movement is possible within that joint. If you look here, this is this medial epicondyle that we call of the humerus, and this is where all those flexors attach. So you can see how they attach here, and then they would run down this arm. Okay. Now I want to just show you this picture on the right because if you look at it, you can see. Okay, number one is the radial head, so that's the top of this blue bone here. Number two is the top of this green bone, the ulna here. And then you have the pink, that's your muscles. The green, yellowish color here are the nerves, and the blue is the circulatory system. So you could imagine, let's just say I change some of the studs, right? So I put this stud over here just a little bit this way. Maybe I make it a little bit crooked this way. What does that do to all these other forces? Now I'm compacting this muscle, which is now pulling it, making it longer, compacting on this nerve, right? Or if I go this way, maybe I rotate this muscle a little bit this way and compress this muscle tissue into this nerve, which could cause some radiating symptoms into my hand, right? A lot of these types of things could happen with just a slight rotation. And I'm sure a lot of us have had those experiences, whether we crack our knuckles or you move a certain way and you feel your elbow pop, it doesn't hurt, right? But what that's indicative of is the fact that a lot of times um, bones are slightly out of position, right? When you like crack your knuckles, like I just did there, what I'm doing is creating an overpressure that allows it to articulate as it should. So you have to think about that. These high forces, like out here where I'm working in construction, they're working on wrenches, they're tightening down insulators and things like that. And they're using a lot of force and creating a lot of force, which creates a lot of torque, which could create this pulling on the bones that causes a rotation. So when we put all this together, if you have two pencils near you, you can do this kind of little experiment where you take each one, hold it like this, because when you rotate your hand over and back, the bones of that lower arm actually rotate over each other like that. And so you can see as you feel that in your hand, where on the ends of those pencils, how it kind of pushes on it, right? And you could see how there's a lot of torque in that, which could cause these bones to shift. I like to look at it as like a power line, right? If any of these poles or hardware here, the cross arms are crooked, what happens is you see how the tension kind of bounces around, right? And you could see that. So you could see how it's straight here on this first pole, but then the second pole it crooks over. So what's that doing to this insulator and connection here? It's creating a force where it's pulling it this way. The same happens with our elbow and our arm as it rotates there. So that's where this theory called the positional fault hypothesis comes across. Sorry. It's a foundational theory developed by Brian Mulligan, and it kind of thinks of this mechanical model like, okay, we create a lot of torque, which from our muscles, which connect to the bones, right? How do you, oh, sorry, I was looking at the comments. So what happens is a lot of the Mulligan comment, sorry, got me again. So what happens is our muscles connect to bones, right? And they contract and relax, right? Well, when they can contract so much that it causes one end to kind of rotate or move where it's supposed to be stabilized, right? Especially if you're doing this a lot of times, right? If you're doing a lot of repetition and you're fatigued, you're sweating, you're tired, you could actually create this force where it knocks a bone out of alignment, right? And that's just some of this torque that we're talking about here, where it knocks that bone out of alignment microscopically, right? If you took an x-ray, these patients or these employees look normal. There's no issues with them, right? But then you go ahead and apply this technique and you relieve their symptoms. Okay. The big thing with this technique, because I'm running out of time, I want to hurry up, is called the pill effect. This should be a pain free technique. It should be instant relief, and you should see lasted improvement, instant and long lasting improvement with this effect. So, for the sake of time, I'm going to jump to the good part right here, which is what we call the self mobilization with movement for tennis elbow. This is yours truly. I'm thinking about a modeling career after this. So what you do is you actually lean into a door knob or into a door frame, right? As you stand into that door frame, you're having all your weight kind of push into this upper part of your arm right here. And what you do is you actually just kind of have it push in. You can use a pad, you could use a towel that's rolled up to kind of push against it. And then you use the inside webbing of your hand here, right? And you're going to push it into this part of your arm on the bottom. You see that in A. And as you're pushing there, right, so it looks like that right here. The door frame is on this side. I'm pushing here on my arm, and then I'm just pushing and gripping and pulling like that. You should feel an instant relief. And what you're doing when you're doing this is right here on this picture. This actually can translate either medially over here or laterally over there. So if it's medial, we're applying a force here. So we're assuming that this whole uh, joint is too far medial. So we're going to push it a little bit laterally, and you may even feel a pop. Because of that, when it's pushed over here, as these muscles of that flexor attach here and they rub against this bone, it causes that discomfort. It weakens your hand, and your muscles now have a fulcrum in it that weren't supposed to be there. And this actually helps reduce that. So as you're doing that and you're gripping, you'll actually see your grip strength actually improve throughout that motion. So that's kind of the technique. Typically, you do that 1 to 2 sets of 10, 2 to 3 times a day. You should feel instant relief with this, and you can add this into a pre-shift warm-up as a prevention technique, especially if you have anyone who does do a lot of repetition, a lot of repetitive movements, anything like that. I know that's a lot, but yes, that's all I have. Questions, comments, concerns?
Awesome. I don't think oh, I'm not paying for your modeling career. Okay. Squirrel. That was a great presentation. Thank you so much, Dr.
Yes,
Brandon.
there was a lot to cram in 20 minutes. Sorry.
Yes, there was. And but you did it. You did amazing.
Yeah.
And who knew that elbow grease had such a scientific approach?
Yes,
It's
yes, yes.
awesome. It's very interesting. So yeah, thank you so much. And Mariana says, awesome, you did great. Yeah. So thank you again for hopping on. And for everyone else, don't forget that CIP Solutions discussion room, the ergonomics edge, turning strain into strength. Um, you can go head in there at any time for some additional discussions on how to keep you and your people healthy for the long haul. Because we only have one body, and even a minor injury can take a toll. I'm feeling that every day of my life. Uh, Even if you feel like maybe it's too late, I'm here to tell you firsthand that you can still prevent things from getting worse. So definitely reach out to Brandon, and he's a wealth of information. So
Yes, I'll be in that breakout room as well this afternoon. So if we have any questions, feel free to jump on in, and yeah, we can chat.
oh, David did put a thing in the chat, but David, if you wouldn't mind reaching out to Brandon, you're going to be there during the
Yeah.
networking time, right?
Yes,
Okay.
ma'am. From 3 to
Yes.
4. Yes, ma'am.
Awesome. Awesome. Thank you.
Thank
All
you.
right.
Bye bye.
So